Hey guys, Dr. Drew here with Inspire Cosmetic Surgery. I'm just going to talk today a little bit about breast lifts and breast reductions and what's the difference and who should get what. So when we're talking about a breast lift, it's also technically called a mastopexy. And that means that we're lifting the breast tissue, but not necessarily taking a mass of breast tissue out. That can be done with or without an implant, as can a breast reduction be done with or without an implant. So let's talk about a breast lift and a breast reduction. With a breast lift, a formal breast lift, we make an incision around the nipple, straight down the fold from the nipple areolar complex to the inframammary fold, and then, depending on the surgeon, some degree across the bottom of the fold. Sometimes that extends all the way over and out to the side of the chest, and sometimes it's only a tiny little area. Sometimes it's a little L, sometimes it's a small T, sometimes it's a big T. If we only make it around the nipple and straight down, we often refer to that as a vertical lift or reduction, and that is called a lollipop style. If we do it around the nipple, straight down and across the fold, that's called an anchor or T-shaped incision. Technically, we call it a wise pattern incision. So the difference between a lift and a breast reduction. So when we do a lift, we make an incision around the nipple, straight down the fold, maybe a little bit across. We then build a paddle of tissue underneath the skin where you can't see. I like my paddle of tissue in this direction, and that paddle of tissue brings blood supply and nerve supply to the nipple areolar complex, and it keeps the nipple areolar complex alive, and it enables us to move that to its new position. So typically somebody measures somewhere between 18 and 21 centimeters from the sternal notch to the nipple. That's an average normal measurement. When that measurement starts to get to 23, 25, 30 and more centimeters, that's called ptosis, where the breast starts to droop. We want to lift that ptosis back to a normal position. In order to do that and to transpose the nipple areolar complex to a new height, like up here, we have to have this blood supply. This is called the pedicle. So that pedicle brings this blood supply here, and it enables us to lift the nipple areolar complex to its new location. So when we do that, this has to have enough blood supply to keep that alive. If there's not enough blood supply, this nipple areolar complex can die, and we can be left with a wound. It's a bit of a disaster. You can recover from that, and we can reconstruct that, but we don't want that to happen. It happens once in a while. If a surgeon's been doing these long enough and has been doing enough volume, one day they'll have a patient with a nipple areolar complex that dies. It's not necessarily the surgeon's fault, it's more so the patient's anatomy and blood supply. So when we do a lift, we move that nipple areolar complex to a new location, and we also remove skin in this anchor shape or T-shaped incision in order to remove excess breast skin and lift the nipple areolar complex to a new location. With a breast lift, we're mostly removing a little bit of skin, repositioning the nipple, and shaping the breast. With a breast reduction, we're actually intentionally removing a significant amount of volume from the breast in order to lift it. But a lot of the incisions are the same, the pedicle is mostly the same, and everything else is relatively the same except for the amount of tissue we're taking out. Now, we can also add an implant to a lift or a reduction to give some more upper pole fullness or projection of the breast in general. So we can tuck an implant either above or below the muscle. Generally, I put this below the muscle in order to give a little more of that enhanced breast look if somebody desires that. There are other styles of breast lift that we can cover in a different talk. There's also a couple of other styles of breast reduction. This is what I tend to do most of the time.